Prime Wellness in South Windsor. And I'm going to pass it off so we can all introduce ourselves. We don't have, doesn't seem like we have a moderator, so we're going to kind of do this on our own. So you've got some great minds here. You can pick our brains for different health conditions, different concerns, how to use cannabinoids, what makes cannabis medicine. We'll be happy to share any of that with you, and all of that with you, and a little bit about what we do. So we can make this really a nice interactive conversation on a Saturday afternoon. How does that feel for everyone? Okay.
Hi everyone, my name is Dr. Paulina. I'm a family nurse practitioner. I'm the founder and owner of Higher Med. We are a health and wellness clinic based in downtown Plainville. We also see patients via telehealth as well, all over Connecticut. Primarily what I do is cannabis card evaluations. We do PTSD evaluations to diagnose patients and get them started with the MedCard process. We do consultation visits and cannabis education as well. How I got into this space, so my background is actually in primary care. I have about a decade of experience now in primary care, so I started out in a community health center setting. I then became the lead medical provider for their Healthcare for the Homeless program, and so I worked in several different homeless shelters, domestic violence shelters over the last 8 to 9 years. And during my time working with that population, I really got to see how cannabis helped many of my patients reduce or come off of their narcotic and opioid medications. It really helped patients who had tried conventional medications for their anxiety, sleep issues, chronic pain. And so I began to delve into learning more about cannabis as medicine, which led me to participate in various conferences, webinars, associations for healthcare professionals. And ultimately, I became one of the first providers within that primary care company to certify patients for medical cannabis cards. And unfortunately, my company did not like that very much. And eventually, I ended up leaving that company and starting my own business, which is now Higher Med. I still currently practice at a local hospital as well, so I'm there part-time as well as in my business. And I'm hoping to eventually phase out of that role and do this full-time. But it's been a privilege, and really, it's been wonderful just seeing how we can heal patients and really treat these severe conditions that are often refractory to conventional medicine with something that is found in nature and has a much milder side effect profile. So, and I'll hand it over to Erin next.
Hi, so I'm Erin Dolittle. I'm a marriage and family therapist. I'm not a doctor, but my last name is Dolittle. And so I've been a therapist since 2007. I've been in private practice, and for many, many years, I just sort of had to watch my patients struggle with big pharma, taking antidepressants and medications that didn't really work, but did things like make them gain weight, beat up their liver, beat up their kidneys. They still weren't sleeping, they still weren't eating. And so around 2010, I actually discovered cannabis, which I had never even thought to consider in my whole life. Found out for myself as a PTSD survivor that it works really, really well. And I went from, panicking and agoraphobia, essentially not really able to leave my house for about 19 years, to being able to do things like this, which is insane. My cocktail was Imodium.
Congratulations.
Thank you. I can definitely say I was able to get off of medications that I knew weren't good for me, but they were just what I had to do to get by. So now with my patients, I work a lot with cannabis. I've been in the medical certification program since 2018, certifying patients for the state program. That business is called Compassionate Solutions. It's still there because I really wanted to help trauma, because that to me is the root of everything. If we didn't have trauma, we wouldn't have anxiety or depression or insomnia or any of this stuff. We really wouldn't. And so when I really started to learn more and more about cannabis and find out, it's a huge anti-inflammatory. Trauma is a whole lot of inflammation in your central nervous system. So it makes total sense that it works so much better than all those SSRIs and SNRIs that are really going to work your liver and your kidneys. And if you know about health, you know how important those organs are. So I'm very vested in protecting them. I'm also very invested in reaching, communities that don't get a lot of attention. And I find that cannabis is an excellent way to get in and start conversations with literally anyone, any age, any race, any socioeconomic background, any level of education. Everybody wants to talk about weed. Yes, they do. So, it's a beautiful way to sort of open a door into someone's life and ask them, what do you need? How do you feel? Okay, how can I help you with cannabis with this? How can I help you be healthier overall? Live the life that you deserve to live. You shouldn't just be surviving and barely getting by. How can I get you to thrive? And so getting into the medical program here really opened a lot of doors for a lot of patients and for a practitioner to see patients, just flourishing. When for years I could just see them, stuck on these meds. They're not really getting anywhere. They're not feeling well. They're not having a high quality of life. And cannabis allows them to have the quality of life that everyone should deserve. It lets me have the quality of life that I get to enjoy. So it is an honor and a privilege to work with this sacred plant. And my hope is to keep spreading the word and letting people know, hey, it's okay. We're going to fight the stigma. We get it. People are going to look at you funny, but I'm going to help you with that. We're going to boost your confidence and let everybody know that you know what you're talking about because you've done your homework. So with that, I'm going to pass that.
Yeah, thank you. That's great, Erin. And that's really, I think we all have some synergy here, is that, so once you get certified from these women, you go to the dispensary. In Connecticut, the program is a pharmaceutical program. So I'm a registered pharmacist, and that's where I'll sit down with you and talk about what medications you're on, what medications you're looking to get off of, and really using cannabis in the appropriate dosages and timings with your other medications so you can safely discontinue without being affected by the withdrawal. A lot of people don't realize that there's withdrawal and discontinuation syndrome with drugs like Prozac and Lexapro, right? She was just mentioning the SSRIs and the SNRIs. It's incredibly dangerous to abruptly discontinue or to do a quick taper. So at the dispensary, I've been doing this since 2015. We've helped hundreds, if not thousands of people get off of their opioids as well as their SSRIs or their SNRIs safely, and not only getting off of those medications, but actually using cannabis to treat the symptoms that they were put on for that drug in the first place. To effectively treat the anxiety, the social anxiety, the insomnia, to help balance your weight, all of these things that you can do cumulatively, right, with just different cannabinoids from one plant. So that's really looking at your lifestyle. So when I counsel a patient on maybe getting off of these medications or with their PTSD symptoms, even their pain symptoms, looking at different cannabinoids. So you have THC, right, which is the main component to the plant, but it's the only one that makes you high. In Connecticut, we've got CBD, we have THCA, we have CBN. You don't need to wait to the end of the day if that's the only time you can be under use THC to feel better. So we can, what I like to do with patients, I say, walk me through your day from the moment you wake up. And this is a great exercise for all of us to do. The moment you wake up, where are you mentally, physically, and emotionally? Is your body stiff and pain from arthritis? Do you wake up in fight or flight? Or do you wake up with tremendous feelings of dread? Well, we're going to look at that and treat you with the right products as soon as you get up in the morning. And also think about what you can take the night before that might last into the morning so you wake up feeling a little bit more, you want to wake up feeling good. You don't want to start your day 5, 10, 50 steps back. So really using cannabis in that way throughout the day, staying ahead of your symptoms, and really getting that outcome you're looking for. So asking yourself, where are you at throughout the day? What medications are you taking? Are you taking Advil? How much Xanax are you taking a day? How can we stay ahead of those symptoms and get you to improve? So that's what I really love doing when I work with patients, is getting them to that place where you can stay ahead of your symptoms, reduce the severity and the frequency of your symptoms by using cannabis regularly.
What I was going to add is it's really refreshing to hear that you have this whole, approach to evaluating and seeing the patient during that first consultation. Because I think one of the main drivers for why I started my business was time and time again, patients were coming in and saying that despite having their medical card for years, they still had no idea what they were doing at the dispensary. And I think oftentimes, unfortunately, even though the dispensaries are technically run by or at least employ pharmacists, some of these pharmacists unfortunately don't have the background knowledge that you do. I mean, many of them I think are coming, right out of retail pharmacy, and not that there's anything wrong with that, but I do think that there is quite a learning curve when it comes to cannabis.
You're absolutely correct, and I've seen such tremendous evolution and progress since I started. So it used to be, okay, if you have a headache, try this when you feel your headache coming on, and let me know if it goes away. Now the way I treat migraines is completely different, right? I use it. So there's a really great theory. It's called clinical endocannabinoid deficiency, and it ties together really enigmatic, like puzzling disease states to Western medicine. And it's fibromyalgia, irritable bowel syndrome, and migraines. So those are diagnoses of exclusion. So basically, if you go to the doctor and you say, I have a headache, I have a headache, I have a headache, they'll run a bunch of tests and say, okay, well, you don't have this, you don't have this, you don't have this, so let's call it a migraine. Well, that's not really helping you a whole lot. So the theory is that we all have an endocannabinoid system that plays a part in every physiological function in the human body. Now it's a quote from scientific literature, and that really explains why cannabis is good for so many different disease states, right? So when you start slowly and gently supplementing the endocannabinoid system for something like migraines, this is how I treat it, for example. You'll take patients down from 3 to 5 debilitating migraines a week to maybe 2 a month. Then you're also helping them with their anxiety. You're also helping them with their insomnia. And you're also helping them with their mood and being the better version of themselves to their loved ones, right? Because when we're in pain all the time, we're snapping, we're irritable, we're not able to engage in relationships as fully. We're not even able to engage with the relationship with ourselves fully, and that's the most important relationship that we have. So I do like to incorporate all of that when I speak to patients because they're past traumas, childhood illnesses, what have you been through? All of that's going to play a part because I think I learned that from the plant. I learned from the patients when, as you were saying, they start off on their first appointment, right? Their eyes are glazed from too many medications. They don't want to take up too much space. They've got their head down, right? They've got their hoodies up. And then I meet with them and I see them like maybe 2 weeks later, their energy is different. They're vibrating different. They can hold their head up a little higher. I have a great story of a young woman. It was like December of last year. And she was overusing her Valium, unfortunately, for her pain condition. And that happens sometimes. And she was on some opioids and some other things. She could not get out of this depressive, anxious kind of funk that she was in for a couple of years. And so important to know when you are looking to get off of a benzodiazepine or an opioid is that this is how I do it if you guys want to know. Okay, so I will use the right cannabis products based on their tolerance and work with them to first manage their symptoms so their symptoms are under control and then slowly reduce something like a Valium. So you're not doing 2 things at once. It's too much for the body to handle. It's too confusing also just for the patient. And so I get them their symptoms, and I do this with pain too for opioids. So I get their symptoms under control with cannabis and then discuss with them which doses we can slowly taper off of, and I may need to speak to their physician as well. So that's really a key to do it. You don't do both at the same time and you still never rush it. But working with her, I think it took like 6 weeks. And then she didn't need me anymore. She knew what to choose when. And when I saw her 6 months later, hoodie off, makeup on, eyes glowing, smiling, she was comfortable in her space. She was vibrating at a different frequency with like health and hope. And I think we all see that. That's why we love doing what we do.
Exactly, that is that health, that hope, that glow.
Yes.
Like that is the best part of this job, like by far. And so folks, yes, this is how providers should sound when they're talking to you. If your doctors don't show this level of expertise, that is probably not a great sign because there is so much disinformation and misinformation out there. And I was taught, oh well, if you smoke pot, it's going to cancel out all your other meds. It's going to cancel out your opioids and your antidepressants. That's not true. But it's a myth. It's a thing that floats around, and that's why providers like this are so important going forward for folks because you can come off meds safely and carefully with support, and there's no shame in using cannabis for that at all because if you want that healthy glow, you're not going to get it from Valium. Really, like just knowing that folks like this exist exist, hopefully, is a comfort to folks because there is such a stigma still. And so, we fight it every day. We try to, comfort our patients and assure them you're not crazy, your family's not going to reject you. And if they do, then too bad, and they should probably come talk to us directly because we would be happy to address that.
But I feel like there's a stigma to marijuana usage. There's also a stigma to what you were saying, refractory patients. You keep going back to your doctor. And when I say the medical marijuana patient is the bravest person. They're advocating for their own health, and they're saying this isn't good enough for me. I don't want to live with these side effects. I really don't want a headache ever. I deserve that. That's my divine birthright as a human being. And you keep pushing, and then the doctors, there's a stigma against you then, right? The doctor's like, oh, no, this one's back. I bet this medication didn't work. It's because you're aware. A lot of these medications don't actually benefit people. I think with the SSRIs, it's beneficial for 1 out of 8 people who use it. Like the success rates are so low on these drugs. And so what happens then is that when someone does try to come to use medical marijuana, they've been on maybe Prozac, Lexapro, they're trying so many things. What I want to tell anybody who's going through that, there is nothing wrong with you. Because people come and say, there must be something wrong with me, that this drug is working for everybody else except for me. There's nothing wrong with you. You're self-aware and you're advocating for your best self, and we want to celebrate that. That's just a message I want to give out. And also what you were saying about the pharmacists, so it's progressed so far. And at our dispensaries, we do offer unlimited consultations with a pharmacist. We do generally do them over the phone since COVID. And that is because you do need a guide. It is complicated, and we are here to help you. We understand. And your success is our success. We want the best outcomes for this plant as well as medicine. I can keep talking.
You can keep talking.
But I'll pause. Maybe we can take some questions unless you guys want to share anything.
How would you advocate for a patient who comes to you with problems? Say they're a perfect fit for pain issues. Do you think that they have a professional? However, there's a snag. They have, they're restricted in, let's say intoxicants. They, for whatever reason, they can't do their substance abuse. What is the solution?
Well, honestly, for me, I recognize AA and NA is very black and white as far as recovery is concerned. But I actually, have recovery groups for people who use medical cannabis because those outdated systems are not trauma-based. They're not mental health-based. So,
Can I just ask you just a quick question? Can you define describe to me black and white about what is your experience with NA that is allegedly inspired?
Well, because I've seen a lot with NA, and if people have to use antidepressants, even if they do so happen to have to use benzos just to get through the day, there is a difference between use and abuse, and finding the right provider and practitioner to keep you on that path so that you're not straying is key. But also cannabis being non-addictive, not having any withdrawal effects really, besides maybe you're a little irritable, maybe you're a little cranky. You're not going to get sick. To me, it just makes more sense to keep people in active and healthy recovery because there's a reason they became addicted to something. No one just wakes up one day and says, this is what I'm going to do. No, they come from trauma. They come from pain. So everyone deserves to have as little pain or no pain as they possibly can. So, I would say there's definitely a way to responsibly, effectively use cannabis and be in recovery.
What is that way?
Yeah, and I would say I've helped so many people come off of, if they're struggling with alcoholism. And it's a balance and it's a fine line. And when you understand that you're using it as medicine, maybe people will be averse to smoking it because that might remind them of something else. So then we'll use sublinguals or tablets or capsules or baked goods. So that can just kind of give a little bit of a line, right? Like between something that's what you may associate smoking cannabis with, so maybe make it feel more medical, but helped hunt so many people come off of too much alcohol. The sublinguals seem to work the best for withdrawal symptoms. And it's tough. It's still going to be tough, but it can be done. You're welcome. I hope that answered your question. Hi, yes.
Hi. So I'm a person in long-term recovery. This is medical marijuana.
Congratulations.
Long-term recovery. I actually founded a 12 You know, cannabis, there are people who are in substance use who they can't handle using cannabis, right? That it's about that self-awareness, about having the connections and the additional support and having people to call you on your shit. Because if you're, you know, shredding from using it or you're using it in maybe a not so recovery-related way, or you're still, you know, hanging out and with people who are still using because you're willing to be high and you're not getting medical relief. That's where the line is, and it's a very fine line, and it does move. There's not a lot of black and white with people. There is in abstinence-based recovery meetings, which is why there are other meetings developing for support for people who are using it, because, you know, it's hard when you have substance use disorder and you need to utilize medication, and abstinence doesn't work. It doesn't work.
Yeah, and also considering using CBD or even CBN and THCA, and so the minor cannabinoids that are, you know, don't have a minor effect in any way, but you know they're not they're not psychoactive like THC. I really like using combinations for people so they can use it more often throughout the day and not just be disoriented or euphoric or dysphoric. So that can be really helpful. You're saying instead of just using, you know, maybe not using the substance and then just using THC all the time, then maybe using a combination of cannabinoids can be very beneficial.
And providing groups like what your nonprofit does.
I want to volunteer.
Right?
Tell me about
She's
it.
fabulous.
Yeah, I want to talk to
This-
you.
I do stuff with Erin.
Okay, that sounds like a beautiful organization. Thank you for doing that. You had a question?
Yes, I have a patient that has all of those symptoms. PTSD, anxiety, depression, which I know she's going to benefit from this cannabis.
Yes.
But she doesn't want to give her her firearm license.
Yeah.
Why is that?
Well, actually, in the state of Connecticut, not, you know, don't get me in trouble, but if you have your firearm license, all you do is you keep that license updated. Don't let it expire, because the medical marijuana program doesn't ask about your guns. They don't care. The only people who care are the actual gun people. So if it's that important to you, it is definitely doable. You just have to not let it expire.
So she can still use it.
Yes.
So I think the feedback that I've gotten, because I do get this question from patients often, or from prospective patients, why they don't want to do that is anytime you go to buy a weapon, you are having to answer about any sort of recreational drug use on that form, and so technically you would be lying on a federal form if you were to say, you know. And so I get that that's not the perfect answer, but I've certainly suggested that to patients before. You know, I'm hoping that legislation changes, but I don't think that is changing in the near future, unfortunately.
Well, there was some legislation out of New Jersey recently that did determine that that is discrimination.
Yeah.
So I do believe as we continue to peck away at the system and wear them down, it's a very slow process to get anything changed when it comes to cannabis. It's very difficult. But I do think as time continues to go by, that is going to be addressed, because it is important to a lot of people.
Yeah, that's definitely a barrier for getting your card. Okay, we can talk about anything cannabis. What else do you guys want to know? I don't know how much more time we have. So I represent the Botanist Montville, the Botanist Danbury, and Prime Wellness in South Windsor. I do have a monthly webinar. So it's called the Canna Convo series. April 25th, I'll be doing Step into Spring, Cannabis for Depression and Inflammation. You can follow us on Instagram at thebotanist.ct. You can follow me on Instagram, Uzma. My first and last name, will post everything up there. And we're also at booth 603, so you can get your information and make sure you have the proper links to get set up for those monthly events. They've been pretty, I really put my heart and soul in them, so I really enjoy doing them. And I'm seeing patients from all three of those dispensaries.
I'm using cannabis as a substitute for mental health medications, and it works fantastic, but it's more about tolerance. I'm just noticed such like higher, more volumes of it to get the same effect as I did when I first started smoking.
Yeah, switch to a sublingual. So you have a couple of choices. So you can do like a 4-day break, and that should reset your tolerance if your symptoms and your mental health allow you to take a 4-day break. If not, I strongly recommend incorporating CBD into your regimen. So that could look like a solution, like an oral solution, a dropper bottle, maybe 30 milligrams twice a day. I can talk to you afterwards. You may want to smoke, you might need to smoke less to get what you're looking for. And also having a clear goal of how it is that you want to feel. Because you may want to, THC gives you a great feeling, but the other cannabinoids gives you another sense of wellness and calm and grounding. So I like to say load up on your CBD during the day. It serves like an anchor. And then when you do use your THC for flares or for triggers, it'll have a different depth of kind of feeling for you. Yeah.
Hi, thank you for your work. I just have a quick question. If I may be a consultant or an advisor, like a co-contractor or a subcontractor or something, whatever you call it, for a private hospital here, about them administering, my plan was to have them administer to someone who's tried and true, who's had their medical certificate for a while. So not what you're doing, so not introducing something, because we never know exactly, everyone's different. We don't know how someone's going to react to it, but I was trying to make it easy for them as like a gateway for them to start administering it while people are in the hospital who have tried and true. Like someone has a regimen, like I do, I smoke sativa in the morning to get me kind of moving, and then I just move over to a high grade, maybe a little bit more dominant in the middle of the day, and then when I want to relax, I have completely indica. It's tried and true for me, and it works. It doesn't cause anxiety.
Right.
No paranoia or anything like that. There's certain things like sativa, you'll be a little bit more paranoid.
Sure.
Or have the agitation. So, number one, would you have any suggestions for me as a presenter to this board?
So what I would imagine, so if I understand what you're looking to do, you're looking for the hospital to permit patients who currently use marijuana to bring their own product into the hospital and use it there.
No, for them to administer it through a pharmacist like you.
So your biggest challenge there would be, where is the hospital going to get the medication from? So legally in Connecticut, there's right now no way for the hospital to have an association with a dispensary and get medication to administer to their patients. I think your best bet would be for the patient to have their own medication and self-administer. And that still might be really hard. We tried to do that with some assisted living facilities. It was probably it was a couple of years ago. It was probably too early into the program where we didn't succeed, unfortunately. But we did work with the nurses and the staff, and the caregivers, would pick up the medication, take it to the assisted living facility to be administered by the nurse. And they weren't ready. The nurses were scared to touch it. They didn't want to have anything to do with it. It was a lot of misunderstanding. So we should try again, though.
Right.
That was a couple of years ago.
Awesome. Thank you.
You're welcome. Yeah. So that's a great question.
My wife, she refuses to get marijuana or refuses to talk to the doctor about it. I've tried things and all these backfire. So I was wondering, what does it look like?
So my first inclination, and let me know what you girls think, is that where is she on her healing journey? Because it sounds like she's having some hesitance when you're.
She's medicated on Dolittle.
Okay.
50 milligrams off.
Right, and then where she is like mentally or emotionally about her anxiety, where it came from. So it's like, I would first kind of want to know, like, where did the anxiety come from? Was it a traumatic incident? I'm not asking you to answer it. This is just kind of what I'm thinking when I'm treating a patient. And I just want to share that with everybody. So when did it start? What's going on? Is it situational? Can we correct the situation? Right? If not, let's look at what's going on. Let's look at when does your anxiety kick in? And what does her anxiety look like on her? Everybody's anxiety in this room is different, right? My anxiety may not look like your wife's anxiety, right? Some of us may be irritable. Some of us have outward signs, shortness of breath, panic attacks. Some of it's all really intrusive thoughts and negative thinking about our own selves that maybe causes us to snap. But looking at that, I would say a combination. CBD does work wonders for anxiety. We have more receptors in our central nervous system for cannabinoids than for anything else in the human body.
That's awesome.
I mean, it is remarkable. That receptor is so powerful. And not only does it just work for fight or flight, it also works in the hippocampus and the prefrontal cortex, all together to help calm down anything associated with PTSD, for example. So I would say CBD is a nice, safe, like, introductory for her if she's not using marijuana at all. And then having realistic expectations. CBD is not what you do feel, it's what you don't feel. So a lot of people are like, I tried CBD, it didn't do anything. It's taking away, it's not gonna give you a whole lot. So people think it's gonna be like smoking weed, right? You're gonna smoke pot, you're gonna feel great, you're not gonna be anxious. CBD will take out the intrusive thoughts. Like, patients have come back and said, you know, that those intrusive thoughts finally quieted down to background elevator music. Or I always felt like there was an alarm going off in my head. That finally went away. So it's a lot of things that go away. So I say it's like your shoulders can finally come out of your ears. You can focus on the present moment, but you're not necessarily disoriented. So understanding the expectation from CBD, being self-aware of noticing that those symptoms are gone. Sometimes our loved ones notice before we notice. Because again, we're vibrating at that different energy, we have a different output. But I would definitely introduce that concept to her that she doesn't need to, she's not gonna feel another way. So you're saying that she's on the Zoloft. So again, I would look at a couple of things with her, and again, try to manage her current symptoms. So whatever symptoms she's still having, even though she's still taking Zoloft, just by addressing those symptoms properly, once she feels comfortable, then we can start slowly dropping her Zoloft down. I would still do a slow taper depending on how long she's been on it. You're welcome.
Yeah, that's similar to my approach with kind of recommending regimens for patients. I also ask about when their symptoms are most severe, and that will kind of determine whether you're looking more so at, you know, maybe a THC, kind of a more THC dominant medication versus during daytime using stuff that has more of the minor cannabinoids in it and little to no THC.
Right. Yeah, that's a good way to go. Because you don't want to wait all day with your symptoms to save your THC at night when you're home from work. Because you're putting yourself through chronic stress, you're building up chronic inflammation. Why torture yourself when you don't have to anymore? So staying ahead of those symptoms, I think, is really important.
I have a bit of a selfish question for you, Uzma. Tell me a little bit about your kind of approach to when you initially see a patient and figuring out a good regimen for them. What are you typically looking for? And I guess in terms of finding specific strains or products for patients, are you looking more at the terpene profile, the minor cannabinoids? Does any of that play a role in your decision?
Absolutely. So all of that plays a role in my decision. So it would start off with, again, getting to know what their goals are. What's their chief complaint? What's bothering them the most? And then also looking at all of their other health conditions, because we know it all contributes. Like, we believe that the body is one living thing. We're not separating it into different systems, right? So I'm always also going to ask for any comorbid conditions, what medications they're taking. Also, if I'm looking, their lifestyle and their preference is actually number one. So that's the number one guide, is what they feel comfortable with as far as delivery systems. Are they cannabis naive? Are they cannabis aware? Are they completely, against it and they can't believe that they're sitting in front of me, right? We get that a lot too. I've been against marijuana my whole life. I cannot believe I'm sitting here. And it's a good joke. They're like, even in the 60s, I didn't smoke anything. And I'm like, that's okay, you're here now. You're here now. So if someone is comfortable smoking or vaping, I'm going to look at the strains and I'm going to look at the terpenes and time it for the right part of day. And then also help them to understand how they can control their dose even though they're smoking and vaping. So you can smoke a little or you can vape a lot. So you can take a 2-second puff or you can take a 5-second puff. So you can use the same vape cartridge throughout the day and get different effects. So if they're comfortable, and I usually save inhalables for rescue or breakthrough, right? So if you need help falling asleep, yeah, let's smoke or vape. If you like the feeling, but I'm going to do the more minor cannabinoids and also THC maybe in a tablet capsule or sublingual. I want to see it in milligrams to get that physiological difference. So that's where I'll use the tinctures and that's where I'll focus on milligrams of cannabinoids. Did that answer your question?
It did. It's interesting.
There's still something.
Well, so it's interesting because I actually had a conversation with another pharmacist who works at a cannabis dispensary, and his take on terpenes, when I asked about that, he said, I don't even look at the terpene profile because it means so little and it's burned off in the production of any sort of edible product.
Terpenes are everything, not in edible, yeah. Terpenes are everything in flower and in vapes, for sure. If there's
I completely
nothing left,
agree with that, which is why I was like surprised to hear that, and that's where like there's such a that's where there's such a discrepancy between even the like education and experience, you know, amongst the pharmacy.
Yeah, I mean, I think we're all probably self-taught, right? Like, I'm mostly self-taught. It was really just when someone sits in front of you and says, you're my last hope, you take that really seriously. It's like a deep place of honor and privilege, right? As we're all saying, I'm going to do the best that I can for that person. So I delved into a lot of research, documentaries, seeing what they're doing in California, and then trying it out with my own experience on the products in Connecticut. And I think I came up with something, you know, pretty good of how I can help people further. But that's really where it came from, was that we're all self-taught. So we're figuring it out. Yes, hi.
So do you have any recommendations for people, any like hacks or behind the scenes you can spend on how costs low at the same time?
Okay, so most of the dispensaries do have financial hardship programs, so I think you make sure you look at the program at your dispensary. And I think also what I like to do, depending on what you're going through, is do higher doses for about 10 to 14 days, and then you can drop down to a maintenance dose, and then talking about, because when you do it consistently and consecutively, that changes the whole game, rather than just using something as needed. So in that way, then you can get to a lower maintenance dose and continue to do that with consistency. And then again, if you like to smoke or you like to vape, understanding your goals, and understanding that you may be able to use the same product in different doses at different times of day, so you don't have to buy so much stuff. So that seems to be working for a lot of patients as well. Okay, I think this was till 3:30, right?
Yeah.
So I think should we wrap up? Sure. Yeah. All right. Well, thank you all for tuning in today. I'll be at the bottom of booth 603 for the